So I'm Valerie O'Brien. I'm a lieutenant back in our detective bureau. Obviously, it's been told to you that I was going to contact you.
Someone was. I didn't know
Okay.
who or what, but I thank goodness, because I couldn't imagine that I was waiting, it's like,
Right.
somebody call.
Okay.
You know what I mean?
So I've asked you to come in here voluntarily
Right.
because this is under investigation.
Right.
So obviously, I need to find out from you,
Right.
from your perception, your side of things, what
Right,
happened.
right, exactly.
I've got to record it in here
Oh, that's
just because
fine.
that's what we do for interviews. So
Right.
just so you know, it is
Understood.
recorded.
Right.
But we do that for most people that we bring in here.
Right.
At any time you feel you want to get the heck out of here, you can get out, walk out. My feelings won't be hurt. Okay. So I guess what I'm looking for is first, do you have a driver's license, just to fully identify you?
Oh, yeah.
I recognize you by face, but
No worries. Do you need me to take it out?
thank you.
Do you need my faculty card?
Nope, that's okay. And this is your current address still? And then, do you have a cell phone that you prefer to be contacted
Yeah.
as opposed to me? When I called the house, I didn't say where I was from.
Oh, that's my wife's phone. That's fine.
Okay, all right.
That's really fine.
I didn't know, so I
Yeah.
just,
If my phone, if no one's there, my cell is.
all right. And then I had sent you an email too, which you obviously can disregard.
Oh,
So,
okay. I'm not good at emails.
no, that's all right. Sometimes
Yeah.
some people are, and sometimes
Yeah.
some people aren't.
Yeah.
So the reason for the delay in me contacting you is because obviously you know the mandatory reporting protocols on campus. No?
No.
Okay. So basically what happens is that it sounds like there was a complaint made over at MSU Sports Medicine,
Right.
which triggers some mandatory reporting protocols.
Right.
So what happens is the Office for Inclusion is a mandatory reporter here to the police department.
Okay.
So they contacted me,
Okay.
at which time I had to wait for the person who was going to file the report to get back into town because they were out of town.
Oh, okay.
So I was able to meet with her today,
Okay.
which is why the delay, so I apologize
Okay,
for
no
that.
worries. Okay.
So obviously a little bit stressful for you
Just
because
wondering and waiting.
you're wondering.
Right.
And so what I also do is I ask Office for Inclusion to kind of hold off, so to speak, because I like to put any type of police investigation in front of an administrative investigation. But
Right.
obviously you probably feel the other is more important because it's
Well,
affecting your employment.
everything. Well, it's affecting her. That's my,
Right.
it's like I want to make sure that this gets resolved so that there's better understanding. Okay, that to me, everything else is irrelevant. It's really, I feel like horrid that she would feel that way, and that's why I'm like, I gotta get some resolution so
Right.
that I know that I'm not allowed to talk to her and everything. But it's good to talk. It's good to talk.
So what is your, and again, I'm kind of coming in the middle of this, what is your status then? And your employment has nothing to do with my investigation. That'll be with the Office for Inclusion.
That's fine.
So what is your, I called the office earlier. Again, I didn't say who I was,
Yeah,
but
okay.
they had said you were out of the office for 5.5 weeks, so I assume.
That was the dean to make sure that, until this investigation was over.
Okay.
You know what I mean? That's appropriate. That's understandable and
Okay.
understandable, right? So I'm doing my autism research right now. So he said, go do your research. I'm working on some development of classes.
Okay, so you're just working from home
Right,
in the
exactly.
meantime?
Right.
Okay, pending a resolution of the university's investigation, I assume?
Right. That to me is the appropriate thing. If someone says that, then I shouldn't be in contact with patients. You know what I mean? So this is a
Right.
voluntary, totally voluntary.
Okay.
It's like, I sat down and talked with the dean over lunch hour on Friday.
Okay.
And we said, you know what, this was probably the smartest thing. So because, that's, if someone is saying that, then it's hard because I'm used to being on the other side.
Right.
The advocate,
Right.
you know what I mean?
Right.
And I'm like, no, then that is totally appropriate. So
Okay.
that's why we're doing this more as a voluntary, thing so that we don't have, why was he still seeing patients?
Right, obviously from a liability standpoint for the university.
Yeah, so that's.
Well, it's great that
appropriate.
your understanding of that, obviously.
I would encourage it.
Right. So my disclaimer is I talk fast. So obviously you can
okay.
probably already tell that. So if you need me to slow down, you got any questions, let me know. And I've had a lot of coffee today, so my caffeine is kicked in. So basically what I'd like to start is what you already know. So why don't we start with that, because it sounds like there's been some conversations that have already taken place. So I'd like to know what you know.
What I was told was that, the patient was concerned that I was inappropriately touching her and didn't understand why. You know what I mean?
Okay.
Like, he was, touching me in my private areas, and she didn't understand why. And those are two things that confuse me because I do this on a regular basis. This is a treatment that I lecture on. I lecture on not only here at Michigan State to the fellows and residents and medical students, but to national organizations, international. I was the keynote guest speaker in Australia to the Australian Olympic Sports Medicine for this very technique. They gave me 2 hours to lecture on it. That's why I wanted to show you the videos, because there's no question I was touching her in private areas. That's what I do. I mean, but and I have stayed off the EMR. Do you know what EMR is?
No.
Electronic medical records,
Okay.
So that's like her chart.
Okay.
So I have stayed out of her chart.
Okay.
So I don't want to.
Since she came in?
Yeah, because I don't want to be like, oh, he doctored or whatever. So it should state in there even that, I talked about this process. You know what I mean? And then for me, I'm the type of doctor that spends, believe it or not, 30 minutes is the quickest appointment that you're going to have with me.
Okay.
It's 30 to 60 minutes, okay, because I do a lot of hands-on and I do a lot of mentoring. I do a lot of talking, okay? So, in her situation, that's why I'm beating myself up. I'm like, where did I go wrong? How did I not know that she was uncomfortable? That's the bizarre thing to me. Okay. It doesn't, that's why I'm like, what signs was I missing?
So that's what we're here for today, obviously, right?
Yeah.
The two sides of every story.
Right. What didn't I feel or perceive that she was feeling that I didn't get? Because if you touch someone wrong, they should tighten up. If you touch someone, and this is what I lecture on too, it's like if you do something that's inappropriate, their body reflexively is going to respond. And I didn't sense anything like that. You know what I mean? And that's why, okay, well, maybe I was just talking too much, because I talk and.
That's what she was saying.
Yeah. But and so I'm known for this.
Right.
I mean, you know what I mean? And her body, he picked me, okay, because that's my area, and I know how to. I can show you the stuff, but that's why I'm like, because I tell people the touch is a personal thing, but there's a difference between palpation and caressing. You know what I mean? There's a total different, like, I tell a story, this is a true story, about when I was dating in medical school. And the reason why I went to DO school was for the hands-on stuff. And it ended shortly thereafter because we'd be intimate together, and she'd say, "You're palpating again," because I'm like, "But I can fix this." You know what I mean? And so I was like, so I was more in tune, and that's how I've made my reputation, is very in tune to the person's body, okay? And that's what makes me the doctor that I am, okay? And so that's why I'm like, how the heck did I miss any signals? That's number one. Number two is also like, I don't get it. Why didn't she say something if she was feeling violated in any way, shape, and form? There was no communication to me, and that's why I'm like, what? Am I blind? Am I deaf? Didn't I hear or see anything? And she never, and she felt better. My understanding was when she was done that, because when I'm working on people, it's like, okay, how's it feel now? Number one, number two, what feels better? You know what I mean? And the pain was going away. She was getting better. And so if I'm resolving a problem and in constant communication with the patient talking, I don't get why she just didn't come out and say something. Okay? So those were my frustrations that I'm going over, because I obviously, if this happens once, it could happen again. I've been doing this for 15 years or whatever, and so wake up, have you gotten too comfortable? Are you too relaxed about it? And I'm like, the only thing that I can think of is that I was trying to whatever, you know,
Okay.
and she was like, boom, boom. And we were talking about that, you know what I mean? Because what I try and do is gain confidence in the person, and then I help them, you know, because I always tell people there's physical injury and there's mental injury.
Right.
And so much of it is more mental, you know, and people, okay,
Right, very true.
okay, so if I can get to some of the causes of the pains, it's people, I get referred all the time, people have pain, they come to me, their pain goes away. One of the biggest differences, I talk to them.
Right.
You know what I mean? And so I'm like, was I too involved talking to her? Or did I get into her space? Not this.
No, I hear you.
You see what I'm saying? And what I was told was that what made her call Dr. Kovan was, this is what Dr. Kovan said, was because I liked the picture on Instagram. And I liked the picture of her. She happened to be in the picture.
Okay.
Okay? And because I liked that picture, that's what made her call Jeff. And so I'm Dr. Kovan. And so I'm like, well, is it because she felt I was stalking her? I was trying to get into her space too much? You know what I mean? I said, you know, I right now, I couldn't even tell you what she looks like. Okay? I mean, like.
But you know who we're referring to, obviously.
I don't even know her first name.
Okay.
I just know, you know what I mean? Because.
Family.
Yeah, I know. You know, but honestly, right now, and that's why I'm staying on the EMR. I can't even recall her first name. Okay? But it's like, what the heck, you know? So I'm trying to think to myself, you really screwed up because you got into her, you broke into a space that she didn't want you to break into. You know, from my thought is from a mental standpoint that then clicked off, well, maybe this wasn't a therapeutic or medical touch.
Right, which that definitely could be part of the reason why she thinks
right,
and why she's reporting what she is, which that is a portion of it.
Right.
So, what specifically did Dr. Kovan tell you that so is he the only one that spoke to you about this?
Dr. Kovan told me, then Dr. Dietzel, he's our clinical director.
Okay.
Right. So, and then of course the dean.
And did he tell both of them, or how did they find out?
The dean found out through the university. And so
Okay.
when the dean called down Jeff on Friday, or Thursday, Friday, one of those days. And so then Jeff came into the office of the dean at 7:30 in the morning. So I think it was Friday.
This past Friday?
Right.
Okay.
Right. And then the dean called me down Friday afternoon.
Okay.
Okay.
So Dr. Kovan was the one that first initially met with you.
Right.
So what did he say? And obviously there was the issue of the Instagram picture. What else did he tell you?
That she felt violated, you know, that I was doing, like I touched her breast and that I moved her underwear out of the way, you know, and I'm like, yeah, you know, I do that all the time, you know. And he said that he tried to explain to her too that, because I've taught Jeff, Dr. Coleman, how to do this stuff, you know. So he was like, but he said, because she said, Jeff said also she didn't want to make a big deal out of it. But Jeff said, because you're talking to me, I will move this forward because that's what I have to do. Because that's right, you know what I mean?
Right.
So she didn't, according to Jeff, said she didn't want to make a big deal of it. She just wanted to let me know and, you know, to try and take care of it. You know what I mean? So, so Jeff moved it forward. You know,
I assumed, or did he tell you that when he contacted
whoever? You know, he just moved.
Okay, so he just told you he moved it forward.
Right. So that's how it got moved forward. You know what I mean? But like at that time, he was like, I explained to her that Larry does this all the time, and there's, you know, that he knows what techniques, you know what I mean, that I do, and that is true. I mean, you know what I mean. That's why I brought the computer. I think if you see the videos that I educate people on, you know what I mean, that's what I do. You know what I mean, and I can, if someone has a rib problem, you know what I mean, I can fix their rib, but if I can't, a lot of times you can't use the shoulder, there's myofascial techniques, you know. I can fix their rib by having my hand on their bottom area, and I can fix their rib by, you know, from above, okay. There's just myofascial techniques, but it's medical. That's the problem. Like, how did she not...
So those would be some of the things we work through, right? So what may be helpful is if we start off with the videos. That way you can show me, and then what I'll probably have you do, if you don't mind, if they're not too long, and you can email them to me.
Oh, I got a Dropbox.
Oh, perfect.
Yeah, I made a Dropbox for the dean, you know what I mean? I can't get on.
You know.
But I can send you, you can send me an email?
Yep, I sent you an email.
I can send you the link to the Dropbox?
Yep, that'd be perfect.
Okay.
Yeah, they normally have our wireless pretty well locked down here.
Oh,
so.
yeah, no, I can send it to you when I get home. Would it be under sports medicine? I have it in so many different areas because
No,
this
that's
is
okay.
like this
Take
is
your
my
time.
Australia. Okay, so this is what I was down in Australia doing the lecture, and it looks like I put a few in here. So this is what probably it looks like would be on the drop box, the majority of it. So let's go back in time. Okay, so this was like my first video that I ever made of this. It was made on a VHS tape.
Oh, Lord,
okay?
yeah, we're going way back.
Yeah, okay. Okay, so her parents are in the room, and I wanted to give this lecture. So she volunteered. It's the first time I ever met her. Okay, and she had see her chest movement, so that's her range of motion right now. Okay, so this is what I do. So she had physical therapy, 6 months of physical therapy. Okay, she'd been resting, and they're like, okay, let's go see this doctor in Lansing. They came. Okay. So I'm doing the palpation of this part, but let me just go forward here. But you can see where my hand is going here now, but that's nothing compared to what I'll show you. That's her strength there, okay, but right. Let me do this here. So I tested in different areas. So now she has pain there from this, but. So okay, so now I'm doing one of her her leg treatment. Okay. Go. Anyways, and then I work her up. I gotta keep going. This is just the video of it.
No, that's okay.
So now look at the range of motion just from that. Okay. Remember the range of motion was here.
Yeah.
Okay. And then I worked the fascia up the rest of her back. Okay. So she came in with a hamstring problem. Okay. But so where am I working? You see what I'm saying? I always tell people it's like from your ponytail to your big toe. Okay. Now for 6 months, and now look at this range of motion. One treatment. Okay. And that's where she couldn't get for 6 months. Okay. You start doing this, and it's without even stretching her. Okay. The voice is off.
No, that's okay.
But so you can see that it basically doubled her range of motion without even starting. Now I'm starting to do a little bit of stretching. That's the end point. You can tell when her body language is. So that was like, okay. Back then, I was thinking I was treating like the operator internist. I was trying to figure it out. Okay, the way that I first started working in this area was a gymnast had a hamstring problem and said they weren't getting better, same type of situation, and she was guiding me. And she was like taking my hand, and I'm right in her vaginal area, and she said, that's it. And all of a sudden, with my hand there, her range of motion doubled. I'm like, what the frick did I just do? And so I did all this research, and that's how I became known for this, because I did all this research to try and figure it out. And I met with Dr. Greenman, who was he's passed away now, but he wrote the book on osteopathic manual medicine, principles of manual medicine. And he's like, I think you're doing more sacrotuberous and pelvic floor as opposed to operator internist, So anyways, so that's why this is like, okay, that was the beginning. You can see how long ago that is.
Yeah.
So, and this is what I made for the lecture. And I do these videos all the time and send them to everyone leaves instead of paper. They do the video on their phone.
Okay.
Okay, like if I wanted to go see a therapist or a doctor in a different area. So these people came up from. Here we go. So this is in my lecture that I give now. You can see this is in our new office and everything.
Lotion, and this is for the myofascial release.
Better quality, obviously,
She
because.
does not have very good external rotation. She's got so with that hip like that, I don't want it to work.
Now her parents are in the room, for this too, of course. I think her mom actually is holding the camera.
Right where the ischial tuberosity.
I'm trying to show it on. You can't really see it on the skeleton there, because like I said, they were holding the camera, not.
So I'm trying to avoid that.
But then here.
Coming up right through here with my counter pressure. Over just unplug it a second. This. Here, just unplug the cord. There you go. Yeah, it should be fine. Come on over. I want you to actually see so Jamie can see.
Okay.
Okay, so now, is like where the leotard line would be if she's wearing a leotard. She's got a little tape. She's been taping her sacrotuberous ligament with
It's one of
kinesis
the
tape.
things I invented was that tape job too.
Now here's your tuberosity. You're sore right here, correct? Okay? So I'm going to come more towards the rectum. Any pain?
No.
Okay, so it doesn't hurt there when I push. I'm pushing at about a 45-degree angle. That's where I'm going to put my pressure. And maybe up towards the tailbone a little bit more as I come up. But this is my hand placement. Sometimes my hand has to be actually down here, or I come across. So I'm on the
Pubic symphysis. Okay.
Okay? And my hand supporting the pubic symphysis in the front.
In the front.
Yeah.
Okay, I mean, yeah, I'm touching her areas. You know what I mean? That's reality. You know what I mean? That's
Sometimes I actually have to grab right here to apply that treatment process. Okay? So now I'm going to have you guys come back over here just so they can see where the
okay. So that is now what that's showing like hand placement. But what you can do with that, here's like IT band, pelvic floor. Let me go up to the here's like ribs. I think.
Okay, ready? All right, ready. So now we're going to work
Just
from
update it
the
again.
outside up because she has that butt head connection where she had the pain when she flexed her neck. So I'm going to check her here now.
So my other hand you can't see, but it's in the inner rectovaginal area.
So working half of the spine. Okay? Reverse ligament.
Oh wait, okay, this would be testing her. Okay, so listen to what she's saying.
Now, again, I'm going to bring her leg slightly out.
She's
Okay?
saying it now.
I'm
Pain.
going to push on the tush. I'm going to bring her leg slightly out.
Go back further.
Okay, now, again, I'm going to bring her leg slightly out.
Go back further.
Okay?
This
Yep. So her
pain.
perispinal
See, this is what I want to hear you say.
Yep.
Pain, yes, pain, yes. Did you hear that? Just
Mhm.
briefly. That's what I'm doing up. So where's her pain? Is her pain? Is her pain? Is her pain? She had pain the whole way up, okay? And now I put my hand,
To the ischial rectal fossa or the sacrotuberous ligament.
no.
So the pain goes away
Okay. You see what I'm saying?
all the way up just by putting pressure on the sacrotuberous ligament. Now her paraspinal muscles have relaxed. What I'm treating.
And that's what I've been doing with her. Is like, does it hurt now? Does it hurt now? And I
Okay.
changed from those different hand positions. Pain doesn't hurt? Okay. You know, so I'll take a deep breath, you know, and then I hold it and work it out. You know, so that's what I'm getting at. Is like, I get her in a position that doesn't hurt, you know, the pain's going away, and I'm talking the whole time. That's when I'm like, if I put her in a position that made the pain go away, and my hand is down there, there's no question about it.
Right, obviously I can see that.
You know, why?
So after this, then we'll roll her over and check her.
But it's a-
motion and see how much further we
It's
can
a
go.
conversation too. You know what I mean? Number one, number two, you know, which feels better. And then I do this because I treat them seated, standing. So like here is even,
This is the side. She was okay when I see her leg. All I want to do is put her hands back behind her like this.
she's doing this long time.
Now, if we do both here, it goes away, right? Okay,
Pain.
put your head back down.
Pain
Head
comes
comes
back.
Punch
Okay.
the foot. Pain goes away. That shows you how the fascia between the above and below. Okay, so what this tells me is that she needs to be fascially released from
But not
the
the.
So when you're force on the figure, don't say down, say down as you're walking. Okay. She's got a stabilized side joint. You shorten your stride,
Throw
you
the
shorten
head in here.
and you long exit the
I'm
stretch.
not gonna do it
That's
right now.
joint. So that needs to be mobile. Just let
There.
it
Okay, now watch.
hold to the side. Sacrotuberous ligament, you
Okay.
rise and applying pressure this way. So I'm pulling out. So my hand's here, okay? She's sitting and I'm pulling this way.
So she's going to be sitting on my hand. Now, I didn't do this with her, but I'm just showing you that, you know, I do this in so many different positions. I do it standing too, okay? So now, she's legit sitting on my hand, okay? Coming up, you know, so you know bone to sit bone.
Yeah.
So my fingers are on the inside of that, between the two sit bones, pulling this way, okay? Change my position. And the pain's gone, because I have to change the, okay? So that was painful, putting my hand there, changing it because of different vectors, forces is. So it takes the pain away, you know. Then, okay, that tells me, okay, I need to do this, you know what I mean? So, and then I actually send them home with exercises.
That's what I was going to ask. So then what is...
She sits on her hand and she does some exercises. So let's, so, and then standing, do I have the one in here? No, I bet you that's just in the actual, this is like Botsford. I mean, I've done this lecture so many times. Let's just do Botsford. Is that, yeah, let's see if Botsford shows us the whatchamacallit one. Do.
And then, so then do you tailor the exercises they need to do depending on positionally where...
I have one patient asked to come in, and she comes up, and it's hers both sides. So she has to take both hands and push up. And it's the only, she's had pain for a year. Okay, and since I've been showing her how to do it, she goes home, does it, and she's treating herself, and she's back to doing gymnastics now. But it's because of all these nerves that pass through here too. It's anyway. So this is oh no, this is an older. The videos aren't connected. Go away. Sometimes when you convert them, I don't want. How about this one? I've been updating them. You know, and now it's like a PDF. This just shows the patterning of how through this ligament you go up and you affect the ribs, latissimus dorsi. This is all from where I found the research was in with Fleming. He did a lot of research on pregnant ladies. Okay, and so I used to joke that I took what they do on pregnant ladies and converted it to my athletes because I work with gymnasts, dancers, and figure skaters. So it's like 80%, 90% of all my patients. They're all hyperflexible.
Right.
What happens when you're pregnant? Relaxin comes out in your pelvis and you get all these problems because of the pelvis relaxing to make room. So it's like, okay, that was, so the research that was done on pregnant ladies, with, following this all stuff, that's what Fleming's, it's in this textbook called Movement Stability and Low Back Pain, okay? And so we're trying to create stability. So it'll morph, it'll make sense to you as I go through it. But anyways, these are from his textbook showing you how this is not just me being crazy man, I mean, this is
right.
Textbooks,
Nothing you pulled out of the air.
Right, exactly, or in this case out of my ass, okay, if you want to put it. But do you see how that goes? You know what I mean? It's like, it's through. And so when you're in, and this is showing how the sacrum rocks. So I'm trying to lecture. Okay, gait, how the gait is affected. There we go. So you can see how those videos are in the lecture presentation. And the slump test, where's this? Oh, like this. This is at Bella Crowley's. This is when we finally got a table in the back room. Okay, and so she came in after 3-4 months of not being able to do her pose. Okay, and her coach was a chiropractor. Anyway, so I did this treatment on her, and that's her range of motion. 3 days working on her at the gymnastics camp at our National Team Training Center, doing those techniques that you saw, and that's her range of motion. After 3-4 months of not being able to raise her leg up. Okay, so I mean that's why it's very powerful. You know what I mean? It makes huge differences. Right. Okay, this is like showing you like a self-treatment. Okay, I teach them to pick a wedgie.
Yeah.
I'm like, pick your wedgie, get in there, pick your wedgie, and you need to pull and stretch, and I'm showing you, then like, okay, and then I'm just showing you that they do that, I teach them to do that themselves, okay?
And you said you've taught the staff over there at Sports Medicine?
Yeah, I gave this lecture at our MSU conference, our MSU Sports Medicine conference, you know what I mean, too, but, so here's standing. So this, obviously she has scoliosis, which gives you a lot of rib pain, okay? So she's not a gymnast. You know what I mean? So anyway, so she comes in from now. She's like graduated. She'll come in and just for this treatment for when her back is sore. Okay, but so I can treat scoliosis because of the ribs. Standing, so I treat this standing, seated. And this is showing like okay, standing you can do it this way. So and then taping it. Okay, there's different tape jobs, and you literally come into the ischial-rectal fossa with the tape job.
Okay, to use kinesio tape.
This is one of our.
Sacrotuberous ligament runs from the coccyx down to the ischiotuberatus. You would actually start, because I would start this up. And when you do this, You want to make sure that you stay off of the rectal area, and of course stay lateral to the labia. If you get too close to the rectal area, of course they can get more skin irritation.
Okay, so I mean, you're coming right where
Right,
this. Okay,
yeah.
I mean, I'm not saying I didn't touch her there. I purposefully touched her there. Okay, that's the. You know, so this was all like sacral tuberous, and over time, and I'll just go. You can see how you can put different layers there, you
At
know.
the same
But
time,
that's
keep that skin smooth. What you do not want to do is create a fold of
you know,
skin.
so you can see how I talk with my hands. I'm always
Yeah, I'm the same way.
okay.
Yeah.
You know, I mean, even on the patient's body, you know. So as I'm talking with her, trying to describe things, I don't know. You know, I see so many people, I don't know. But what I do know is that I've been doing this for so many decades. You know, not decades, but since like 1997.
Okay.
You know, like, why now? What happened? You know, and then so that's where I switch over. And as I move over years, you don't just you create, you still keep doing things. You know what I mean? And so I where is the? Oh, you can get a kick out of this. I'm trying to kick, but this is my leotard.
Okay, this is let's see, it is July 25th.
This is my 2013.
We are in the process of the first prototype.
So I'm trying to put it into a leotard.
Yeah.
Okay. Okay.
Cross. Turn around.
So these were like.
So we have an axis.
This was the very first. But you can see how.
So we have the wider.
And then I've got pictures of all this too as I've been developing it. Because now Under Armour is our sponsor.
Okay.
And our mixed core shorts. And so this is like a core. So we have Under Armour and
One on one side, one on the other side, creating a knee.
to try and lift.
Overlap, so it's a smooth togetherness there. And then we lift, and lift. That's going to help keep the tummy tight. This would act to hold down the straps, okay? And then let your arms fall.
So this was our first demo of it. But you can see how it comes up, you know, to lift and shift. And it's like, I mean, I'm literally trying to design how do I put my hands on the leotard? You know what I mean? Like, so that they can wear it and have the same type of biomechanical support, you know? So we have Jim Kin. I've met with people at Jim Kin, and since Under Armour's our new sponsor, I thought this would be a great project for the two to work together. Okay, so I think on the Dropbox there's actually more pictures of that.
Okay.
But I need to get to another. So what I've gone from is from operator internist to sacrotuberous to going into more. No, it's not there. Transfer. There. Video lectures, USAG PowerPoints. Pelvic floor work is what I'm trying to find that lecture. It's in the gymnastics injuries. I might. This is the latest, I guess you could say. Core lectures. Did I put it in core lectures? Straighten into core, back, core. Okay, let me grab it.
No, that's all
Is that
right.
okay? I'm sorry, I'm not taking too much here.
Nope, that's what I'm here for.
Okay.
And that's what we're here for is figure out exactly what happened so we can take all the time we need.
Are you sort of seeing? I mean, this is literally like, gosh, I wonder if those are on there too. Like the Romanian national, Romania for gymnastics. Okay, their trainer. I just made up videos for them. Where are those? Let's go here. I know they're on the Dropbox too, but videos. Let's go to this external hard drive. I should have just put them all into.
Well, you didn't know I was calling you this
Sorry.
evening, so it's not like you had time to prepare, really.
Anything, right.
But you knew at some point I was calling, but.
Right. Videos for lectures. Hip evaluation, USAG PowerPoints. Is it underneath sacrotuberous? But where's the floor? I bet you it's just underneath my lectures. So I make lecture. I mean, that's what I do. You know, I have all these videos that I do. They all go to the people so that they know what they're doing when they go home. You know. Let's go here. 2 lectures transfer. Lectures. So this was the most recent lecture, and it would be on PE, pelvic floor. All right. So this I gave at USA Gymnastics National Congress, okay, and I gave it also at the last year's MSU annual sports medicine conference. Okay, so that's why it's like, okay, the grand junction was the sacrotuberous ligament. Okay, and then I do a lot of pelvic floor work because gymnasts have a lot of urinary incontinence, the force of pounding, and their urethra's small and they pee. I don't know if you've ever jumped and peed, you know, but
sometimes when I run.
Right. Yeah. So gymnasts are like known for that, you know. So I talk about urinary incontinence and all that stuff, and but this is where I get into more like the culture of it. Okay. Yeah, there you go. You know, the PP problem is a don't ask, don't tell issue, because literally we have to do like PP interventions at times because the little one has a PP problem and we got to talk to him about it. But okay, so this is like, you know what I mean? Because she actually hurt her hamstring up high, you know what I mean? But she's like her hoo-ha, you know what I mean? So she who must not be named. It's like I try and been educating people about these techniques, you know what I mean? It's like everyone can't even say the word vagina, you know what I mean? It's like, hello, you know, you're medical professionals, you know what I mean? Like I've sent people for intravaginal pelvic floor work to Sparrow Hospital. Sometimes you actually have to go intravaginal, you know, too, for this stuff. And so, anyway, so I'm going through the anatomy of this stuff and trying to explain how the muscles, like I've had kids actually strain these individual muscles that I found from physical exam, and people are like, you're full of crap. I do an MRI, they sprain that muscle. I know this area, you know, it's whatever. That's MRI. So what we try and do is we actually teach them to use their pelvic floor muscles, because if they use their pelvic floor muscles right, it actually increases their core stability. So it's when I'm in the pelvic floor area for this obturator and sacrotuberous ligament, you can't help but be affected the pelvic floor. And the pelvic floor is known to actually, if you have this more stable use of your pelvic floor, it actually increases your core stability. So I tell people the core to the core is the floor. Start with the core by using your floor. Okay? So I'm trying to educate people on how to use the floor, and because that's what I figure I'm doing a lot of times is even though I'm there, I'm affecting the floor. And if I can get the floor to contract well, then I can get their their back muscles to work properly. Okay? So I talk about Kegel muscles, you know, so this is part of their exercise programs. You know what I mean? So that's why it's a little bit different. For my athletes that I've done this time, they would have had these home exercise programs, okay? Okay, literally. Okay, I see athletes, okay? The only way I see a non-athlete is as someone saying, will you do this?
Okay.
You know what I mean? So it's like, yes, you know, and then talk about jumping anyway. So these are like trigger points, you know, areas that are mapped out, you know, on the body and stuff. But there's I call it the butt broth, the lift and shift, you know, kinesial tape. But there's another one. Oh man, pediatrics, pelvic floor.
So then you just know.
You know what I mean? So, you know, that's why I'm like, you know, I'm missing the ones for the Romanian gym, the Romanian doctor too. I know they're around here someplace, but I don't think has it at the end. This is another lecture this is the American Osteopathic Academy of Sports Medicine. It's the national sports medicine, like all the doctors of sports medicine doctors in the country. There's 2 more gymnasts that I had done it on too, and look at the range of motion afterwards. But anyway, so understanding the biomechanics of a single ligament makes a big difference. There's more that you'll see in the Dropbox. And you'll see, I mean, I'm pretty graphic in the videos. Okay, and
Which
the
is
ones
obviously going to be helpful to the investigation.
And the
Yeah.
other videos actually talk about, and that's, I know they're on there. This is starting to irritate me just a little bit because I'm like, where the heck did I put them? It'll be, here's the, did it load up? Yes, I was loading up to send some more stuff today. But it'll be, I think underneath this, it'll be like a sacral tuberous, okay, just to let you know, hey, can I actually do this? No, that's not all of them. What happened? I thought I better add those ones with the Romanian gymnast. Okay, Larry, bear with me.
No, you're fine.
But that's why I'm like, I do this is what I do. Why didn't I get the idea that she was viewing, because I have to feel, like I do this on minors, you know what I mean, with their parent in the room, of course, but you have to be able to communicate, you have to be able to sense what the heck is going on, and why I didn't get that feeling from her is beyond me, and and that's a question, I guess, that I can't answer because I'm not talking with her, but she did not vocalize anything to me that she was feeling offended. If anything, like I said, she was feeling like I was, yes, I feel better. Okay, so that's why I'm like, if she's feeling better, what tipped her off to start thinking like, what the heck is this guy doing? And that's, this is just going to be irritating now.
Yeah, if you can't find them now, that's okay.
Okay.
It's
Go ahead. I can look while you're talking more.
So when Dr. Kogan initially talked to you about this, so it seems like there was some time that went by from when he initially talked to you to when you were talked to again.
Mm-hmm.
When he initially talked to you and you guys had your conversation, what was the resolution or outcome of that conversation? So he tells you, hey, she comes in here.
Right. I wasn't that worried about it.
Okay.
At that point, because he had said he explained it to her, and she didn't want to make a big deal of it. Was his words.
Okay.
You know what I mean? But he said he had to move it up the chain.
And that he explained the procedure to her when you say he explained it to her?
He explained it to her. I can't talk for him.
No, I'm just curious if he told you.
That's what he said, is that I tried to explain to her what you do. You know what I mean? And so those were his words, you know what I mean, or paraphrasing because I can't remember word
No,
for
that's
word,
okay.
And she didn't want to make a big deal of it. And so those were the three things was that I remember from our conversation or four things was, it was after the Instagram picture and the moving of the underwear and moving of her breast, and because I was treating her ribs area, and then that she didn't want to make a big deal of it, but she thought she needed to talk to Jeff about it, and then Jeff saying that, appreciate what you're telling me, so I will move this up the chain.
Okay.
Okay, so that was like the...
So then it was just kind of left open-ended for him to
there
follow
was
back up with you?
Nothing else that happened. There was no conversation until Friday.
Okay.
Okay, it was just so I figured, okay, nothing ever happened, you know what I mean, like, then once it did actually then make it up the chain, and the dean called in Jeff Friday morning, that's when it's like, okay, so obviously she's making more of a deal of it, you know what I mean, than not wanting to make a big deal of it. And I told Jeff at that time, I said, if she felt that way, I would encourage her to say things. If she were to talk to me, to say that some doctor did something, I said, you need to discuss this. You know what I mean? Because that's what I am, more of the patient advocate than anything else. It's my role. That's me. I don't know how else to say it. It's like me.
Right. Everyone has their own style.
Yeah. Well, it's not just style. It's you. You know what I mean? As a person, to be able to do this stuff, and to be able to do this stuff for so long, if you don't have patient confidence and patient trust, you would have been having my ass in here how many times?
Right.
Okay, especially when I'm doing this on 10-year-olds, 12-year-olds, okay, with their parents there. But I'm obviously doing a doggone good job explaining things, okay, because what?
That was going to be one of my questions, obviously. So there's never been any complaints that you're aware of prior to this one? And obviously you're videotaping things here. You're doing
right. Well, this has been going on for forever. You know what I mean? Like, not forever, but the videos, you can see I've been videoing and changing and adapting. So I keep, so that it's transforming, from being just the operator intern to sacral tuberous to pelvic floor, you know what I mean? So all of that is the fulmination. The end point. guess I can't find it.
No, that's okay. Don't worry about it.
But you want to see the ones with the, and listen to the words that I'm saying too, okay? And just watch my body movements, okay? When I'm checking things, you know, when my hands are on the patient, please watch, because I could see how she's massaging my breast. No, I'm like, how's that there now? How's that there? You'll see my hands move, okay? It's talking with my hands. It's how's that feel there now? It's like I tell people, you don't want to use left, right, or to your left, or you move it so they know what you're talking about. They can sense movement, right? So if I try to describe how does my left hand feel next to your right, you know, no.
Right.
But if I go like this, you know what I'm talking about, okay? So it's the way that I communicate because your hands are on them. Okay?
So that is exactly what we're talking about. So was there more details given to you on Friday then? Did they go over, because you said, hey, you know, they came back.
On Friday, what the dean said was that it's been moved up the chain, and that this could become a police issue, or it's, you know, that it could become a police issue if she chooses to file a police report or whatever, you know, and that because of that, it'd be in your best interest, in our best interest, if we don't have you see patients right now, because
which makes sense, like you said.
Well, yeah, and I'm like, sure. He goes, you know, so you take the time that we need. You know, I said, you could do the research, do the academic, you know, work that I'm doing. You know, so I said, that's exactly. You know what I mean? So I'm not even going to the high school. You know, I go to I'm Holt High School's team doctor. I'm the team doctor at Twist Stars. You know what I mean? So it's like, okay, you know. So I guess that's where I'm getting at is, what communication did I miss that she was trying to tell me? Okay, did she say anything about verbalizing that I feel uncomfortable or anything like that? Because if she did, I didn't hear it.
So those are some of the things that I'll go over with you. I can go over in very fine detail as to what she said. So I'm not going to hide anything from you. There's not going to be any secrets. I'll go over all that stuff with you.
Okay.
I just wanted to know kind of what you knew up front, and then obviously I wanted to see the videos because what I'm seeing in these videos is basically very similar to what she is telling me happened.
That's what I do.
Yep. So that is why I wanted to see those first to say, okay, are we on the same page? Are we talking about the same thing from the get-go? Which we are talking about the same thing. I've seen those. So it'll be very important for me to get those videos, and especially the ones, if you have ones in more detail, like you said, are a little more graphic.
The ones I sent to the whatchamacallit, to Romania.
Okay.
You know, so those were just done for 2013 European, so last summer.
Okay.
So getting ready for the 2013 European Championships, and was having a problem, and so they contacted me to say, hey, you know, what can you do to help? I mean, England, Canada, Germany. I mean,
Right.
This is what I do. Okay, I'm not saying that yes, I'm there, and yes, it's medical. It's not, I don't know how else to say it, but I'm totally taken by surprise, but at the same time, feel like crap that someone would feel that I was doing something inappropriate to them. Because this is how I make my living. This is what I do. I've helped scores of people by doing these personal issues.
Which is good to hear. It's good to hear that you feel bad that she feels that way.
Yeah, because I feel like this little deviant, you know what I mean? And that's not right. And that's not... Okay? I mean, that's reality. Okay? That's who I am. Okay? That's why I'm like, of all the freaking people, I'm the only guy even allowed in with the national team. Okay? It's all our females. Okay? But because of who I am, it's the trust. If I did something wrong, do you know how quickly that would spread like wildfire across? I'd be out.
Right.
This is my 27th year with the team, you know what I mean, or whatever, since 1986. I've been with the national team, and I'm telling you, those kids, it would go boom, chuck, boom, chuck, boom, chuck, chuck. You know what I mean? Like, no question about it. Okay? And that's what I'm saying is that there has to be a way that a person's able to disconnect. Okay? If you don't disconnect, then you're screwed. You know what I mean? You got to be able to disconnect, because that's what I'm saying is that when you're in that area, you have to be palpating, you have to be doing therapeutic touch, not any other touch, because that sensations can be relayed through your hands. Persons can tell. You know what I mean? And it's like, how did I miss that signal that she felt that I was doing it inappropriately? Was I really that off that day or what? You know, that's my issue. Is and it's hard because it was so long ago, you know what I mean? But it's what I do all the time. So was I tired? I'm like, okay, did I get to sleep that night? Did I, you know what I mean? I'm just trying to figure out, was I off? Was I wasn't sick? You know what I mean? I only get 5 hours of sleep usually a night anyways, you know, but that's normal. Like, did I get less than that night? You know, what made me out of sync? What made me not be able to recognize that I was making a patient uncomfortable? Okay?
So generally, do they verbalize that, or a combination thereof?
There has been a few times where that has been brought up, okay? And in each and every time there was sexual abuse.
Okay.
So that's what I'm saying is when they're uncomfortable like that, there's been 3 cases, and all 3 of them were sexually abused. Okay? So that's why I'm like, yeah. Okay? That's why I'm like, okay, is there something more? What am I missing? Because that's what I'm thinking all the time. Okay? If someone's tensing up or having an issue with this, my first inclination is, were they ever sexually abused? Okay? So that's what I've had conversations with people about, you know what I mean? And now I'm the one on the other, that's what I'm saying, is I'm the one on the other side of the table now, you know? It's
right.
Like, so I'm like, how did I, if for God help me, she's never been, you know, sexually abused, but say if she was, that's my job. Why would I miss that? Because then it's my job to bring help to that. You see what I'm saying? So where am I losing it that if she, God forbid, had been, that I would have missed that cue? Because then it's like, okay, boom, chaka, boom, whole another period of like, it's time to have some psychiatric intervention.
Right.
You know what I mean? So that's why I'm like, 3 times. Okay? And so that's, though there's been other than that, and each one of them were in the past sexually abused. You know, and so, but I'm the one who brings it up.
Right.
Okay?
Right.
You know, she's way uncomfortable for what I'm doing. You know, without them even having to verbalize. Okay? Because
obviously, you can feel a change in their body.
Okay, it's like, that's not right. There's something wrong here. You know what I mean? And so then I talk to, each time it was with a minor. You know, then I talk to the parent. And I'm saying, you know, what's going on here? You know, and then I find out what's going on. Okay?
So you obviously talked to, it sounds like, okay.
You know, so I just was waiting since Friday when I heard that it did go forward to have this conversation, because I don't want her to mentally be going through what someone would be going through when they think that they've been sexually violated. Okay? That's the problem that I'm facing, is that it's a dichotomy for me. It's like, I'm the person that usually puts the arm around them, not the one who's you know, doing the wrong thing. That's the dichotomy that I'm stuck in.
And you're right. So that's what she filed a report for. So right now what the report is titled, just so you know, is a sexual assault.
Right.
Because that is, like you said, that is how she's feeling. That is what she thinks happened. That's her perception of things. So there's a couple different times that she's feeling that you sexually assaulted her throughout the examination.
Okay.
She did say everything that you were telling me is along what she said. Hey, it was a lengthy examination.
Right.
Went to these exercises.
Right.
You were working on basically her whole entire body.
Right.
So everything you're walking me through over here and you're showing me is everything that she was telling me. What she is saying, and you use the words, the same words she used, that she's saying that.
Right.
And then she said that she felt like that you were massaging her breast, and that was not part of the manipulation that you were doing.
Okay.
So that'd be the first piece.
Right. Okay.
So if you want to talk about that first piece as what it is you were doing.
Right. When you're working ribs, okay, if you can't use the arm, if your shoulder, you know, it's like, okay, the muscle energy part, I'll crack a back, okay, so we crack a back, crack a neck, you know, the usual stuff, and then we try and do push against me, and then you do stretches, okay, so when I'm doing stretches, okay, you're on the
Yeah, and again, if you have videos of that too, that would be helpful.
Let me show you here.
Not that you necessarily have videos of everything, but.
I teach the ribs. I gotta find where I'm at. Sorry. Videos transfer. I go back to transfer. Not a lot of people like to treat the ribs, and because I work with the crew athletes, I treat a lot of ribs because the crew athletes, have rib issues, obviously. But that's what I mean. So that's another area that I do a ton of lecturing on because I treat it a lot. I'm in the wrong. I gotta go to. I took stuff off my computer was getting too big, so that's why I got the external hard drive going. Let's go to the external hard drive. Go up to lectures and articles. OMM. Stop. Lots of lectures. All right. OMM, ATC, for example. Ribs, ATC, rough copy. Let's see if that's. Okay, so like this is Dr. Greenman, like I was talking about. Okay, so you can see his hand placements. Okay, so what I tell people is when you're working on the ribs. Okay, I don't like to stand on the side. I do it sideline. Okay, I'll be at their head or I do it sideline.
Okay.
Okay, and I tell people don't come in this way. That's offensive. Come in this way. Okay, if you come in over their head, that's offensive. You know what I mean? It's just the way that I talk about it. So I actually come off from the side.
Okay.
And then I'll turn their head and do some work that way with it. But that to me is a lot. When you come at someone this way, that's more offensive.
Seems assaultive.
Right, exactly. And that's why I'm like, I lecture to people about how you try and not, you come across from the sides, and then when you sideline them, you can do it sideline sitting, like showing prone. But it's the rib cage. You know what I mean? You're going to be on the chest wall. You move the breast down. You move the breast down to get down to the wall. Okay? It's like giving someone a mammogram almost. Okay? And when you do the myofascial, let me see if I've got the. Oh, don't save.
So while you're doing this, are you
Sure.
explaining? I mean,
I always do.
Okay.
Because I have to know if it's making them feel better. That's why I'm like, is that bad? Because if that doesn't work, I'm going to change my hand position. If that doesn't work, it has to be a conversation. I'm not omnipotent. You know what I mean? It's like, and that's why I'm like, I don't understand why she just didn't say, I don't understand what you're doing. Or anything along those lines. It's like, really?
So she did say, while you were working on her, that you did say, does this feel better?
Yes.
And that you were going on with that. What her perception is that you weren't explaining what you were going to do beforehand, so she didn't know what was coming. But that she was very well aware that while you were doing that, you were saying, how does this feel? Does this feel better? And that she was answering,
Right.
either yes or no.
Oh, right.
So again.
Because I can't remember, but I do this on all my patients. If you do the same thing every time,
Right. Yep.
You know what I mean, then I'm like, okay, if I was treating ribs.
Police work, we have to do the same thing, do it the same way every time.
And
that
then
we
you
know.
don't screw up, you know what I mean? So that's why I'm like, so where did she, I don't know if you can tell me that, but did she ever say anything to me?
I'm sorry, I can tell you everything.
Yeah,
I've got no
yeah.
problem telling you
Did she
everything.
say something like, I feel offended, or what are you doing, or can you explain it to me better, and I blew her off?
So what she's saying is that while you were, what she said in her words is massaging her breast, what she said is that at some point she tells you, okay, you don't need to work on my shoulder anymore.
Okay.
I don't need to work on my shoulder. It
Okay.
had like longer term issues and I
Okay.
need more work than that. Do you
Okay.
remember that at all?
I don't remember, honestly.
Okay.
But so did I stop working on her shoulder, or what did I do?
Yes.
Okay, so she said stop working on her shoulder, I stopped working on her shoulder, okay.
Yeah.
So I didn't do anything against her wishes. I mean, right, she said to stop, I stopped, okay?
So what she feels, and again, this is her perception and what she
Okay.
feels, and you're showing me videos, you're explaining everything
Right.
too, which makes sense what I'm seeing here
Right.
too. What she's saying is that, initially your hand was up, kind of on
Right.
her top shoulder area and
Right.
slightly on the top of her breast,
Right.
and then moved down,
To
again,
the
like
ribs. Right.
to, and what she calls is like a full frontal on top of her breast, and that you're massaging her breast.
It
So,
wasn't- okay, go
nope.
ahead. It's okay, I understand her perception.
Yeah, and so-
You can obviously see how she could feel that way. And when we do myofascial, too, you are having her breathe, take a deep breath, exhale, and you're doing that, okay? I mean, as they're breathing, you're doing that motion to try and stretch the fascia, okay? Go ahead, I'm sorry.
No, you're perfectly fine. It's good for you to talk a lot, right? Because then it's more for me to know. So I'm not going to stop you from talking. I prefer you talk more than less. So you're not going to hurt my feelings.
Right.
So what her perception is that she didn't know that was going to be done,
Okay.
but that there was the communication throughout that,
Okay.
hey, how does this feel? Does
Right.
this feel better? Does this not feel better? And then she said she got to a point where she felt uncomfortable and she thought that it was inappropriate,
Okay.
and went to the line of being from a medical manipulation
okay.
to being inappropriate, at which time that she had said, hey, I think you've worked on my shoulder enough. I don't
Okay.
need you to work on my shoulder enough.
Okay.
And again, I know you see a lot of patients. I just don't know if, you remember anything specific to that or her
That's
saying
what I'm saying.
that.
That's what I was wondering. But at least I would do if someone says, okay, I think you've done enough. I stop.
Right, which is what she said you did.
Right. So okay, go ahead. Go ahead.
So that's the first piece of it.
Uh-huh.
Then she says in the first video that you show me where she's flat on her stomach.
Right.
And then what she says, again, just like you're showing me and you're explaining to me, is that your hand had went in between her butt cheeks.
Right.
And then she said the head went more towards her vagina and the vagina hole.
Well, not.
That's the way she's explaining it to me. So,
Okay.
and again, I'm not using medical terms, I'm using her
That's
terms,
okay.
right?
That's okay.